Welcome in HealthCysio, Sindh Public Service Commission test of the pharmacist for the post of drug inspector. This test was held in 2017. Before starting the paper, I request from all members, if you see any answer wrong, please mention right answer in comments, so other members will get benefit from your answers. And if you are new in our channel, don't forget to subscribe, like and share. Question number 1. When needle is used to join the edges of the wound, it is called option A, suture, option B, injection, option C, handle, option D, body. The right answer is option A, suture. Question number 2. Microcapsule technique is option A, extrusion, option B, exclusion, option C, intrusion, option D, all of above. The right answer is option A, extrusion. Question number 3. Benzocaine is topical antiseptic. Option A, true, option B, false. The right answer is option A. The given statement is true. Question number 4. Neuromuscular blocking agent can augment the problem by non-depolarizing muscle relaxant in option A, myasthenia gravis, option B, vasculitis, option C, systemic lupus erythematosus. The right answer is option A, myasthenia gravis. Question number 5. Main sign and symptom of severe pneumonia in young patient is option A, dyspnea, option B, cough, option C, fever, option D, insomnia. The right answer is option A, dyspnea. Question number 6. Menstrual cycle starts dash follicle stage. Option A, 12, option B, 13, option C, 14, option D, 15. The right answer is option C, 14. Question number 7. Histamine causes the sign and symptom of option A, inflammation, option B, redness, option C, cough, option D, fever. The right answer is option A, inflammation. Question number 8. Long-acting insulin is option A, Glargine, option B, Lispro, option C, Aspart, option D, glulicine. The right answer is option A, Glargine. Question number 9. Vitamin D absorbed in malabsorption of fats. Option A, the given statement is true. Option B, the given statement is false. The right answer is option A, true. Question number 10. In pregnancy of 7 to 12 weeks, smoking is prohibited for organogenesis. Option A, the given statement is true. Option B, the given statement is false. The right answer is option A, true. Question number 11. Thyroid formation and development happens in dorsal pharyngeal gut. Option A, endometriosis, option B, exometrium, option C, fallopian tube. The right answer is option A, endometriosis. Question number 12. Another name of emergency box state is option A, survival kit, option B, emergency equipment. Option C, park. Option D, all of above. The right answer is option D, all of above. Question number 13. Maximum absorption of drug take place where? Option A, IV. Option B, oral. Option C, inhalation. Option D, topical. The right answer is option A, IV, which means intravenous. Question number 14. A person goes through a surgery and after the limb surgery, he feels numbness and pain on his limb. This is not due to damage of sciatic nerve. Option A, true. Option B, false. The right answer is option B, false. Question number 15. Galactorrhea is the side effect of option A, domperidone, option B, omeprazole, option C, paracetamol. The right answer is option A, domperidone. Question number 16. Dash types of capsules. Option A, soft gelatin. Option B, hard gelatin. Option C, both A and B option. Option D, none of above. The right answer is option C, both A and B. Question number 17. Which is not sulfur drug? Option A, sulfadiazine. Option B, azulfidine. Option C, zunigran. Option D, domperidone. The right answer is option D, domperidone. Question number 18. Damage to the joint is the side effect of option A, quinolones. Option B, azulfidine. Option C, zunigran. Option D, domperidone. The right answer is option A, quinolones. Question number 19. Main symptom after gastrectomy is small absorption. Option A, the given statement is true. Option B, the given statement is false. The right answer is option A, the given statement is true. Question number 20. A person had a diarrhea. He complains that whenever he stops taking food, diarrhea stops. What type of diarrhea he have? Option A, osmotic diarrhea. Option B, acute bloody diarrhea. Option C, persistent diarrhea. The right answer is option A, osmotic diarrhea. Question number 21. Drug metabolism take place in option A, liver. Option B, intestine. Option C, stomach. Option D, eyes. The right answer is option A, liver. Question number 22. Scar formation happens due to the option A, fibrosis. Option B, lipids. Option C, ligaments. The right answer is option A, fibrosis. Question number 23. Maximum punishment for heroin exceeding 10 gram is 2 years according to Dangerous Drug Act. Option A, 1930. Option B, 1940. Option C, 1950. Option D, 1960. The right answer is option A, 1930.